Such a pleasure to have you here today with me. Thank you for joining us as part of this wider series where we'll talk about AI in lung cancer. If we can start by a quick introduction about yourself, your background and your current role.
Thanks. My name's Sean Duncan. I am a clinical research fellow at the University of Glasgow, and I'm currently undertaking a MD in the role of artificial intelligence in lung cancer diagnostics. And I'm part of the RADICAL study, which is looking at the role of qXR in an accelerated lung cancer pathway in Glasgow.
Brilliant, that's great. So what are the current challenges in Scotland around lung cancer?
Similar to a lot of the challenges around the UK and the world as a whole, which is that lung cancer patients aren't doing very well in general. It's a pretty unfortunate mixture of a poor prognosis cancer as well as being relatively common. And the main reasons for the prognosis being so poor is because a large proportion of patients present at late stage, so stage 3 or 4 disease. It's around 72% of people present at stage 3 or 4 disease. And the problem with that is that stage 3 or 4 disease has reduced treatment options, and that's reflected in the fact that your 5-year survival, if you're in that category, is between 5 and 15%, which is shocking and poor compared to a lot of other tumour groups, especially when we think about how other tumour groups have progressed over the last 30-40 years. We haven't seen that improvement in lung cancer. So that's one of the main challenges Scotland faces, and it's similar across the wider region.
So based on those challenges in Scotland, what motivated the hospital to implement AI?
Well, there is a national movement to try and improve lung cancer diagnosis pathways. We recognise that if we can reduce the time it takes for people to get to treatment, then we can hopefully bring people to the decision about lung cancer treatment at an earlier stage so that they're not in that stage 3 or stage 4 category. And that's been reflected in the Detect Cancer Early programme, which is an initiative from the Scottish Government really to challenge health boards to reduce their time to diagnosis of lung cancer. And so expediting chest X-ray reports is a naturally attractive option to help ease that problem.
Okay, so can you tell us a little bit more about the AI technology that's been implemented as part of this lung cancer pathway?
Yeah, so we're using the qXR chest X-ray algorithm under a research project at the moment in Greater Glasgow and Clyde. And what we're doing with that technology is introducing it at the very front end as a rapid first reader of chest X-rays. So taking advantage of the fact that algorithms can process chest X-ray images very quickly, can they triage a given chest X-ray to an early report? So in our study, what we're looking at is whether an early chest X-ray read can triage X-rays that show signs of cancer to early reporting by radiologists, because if they get an earlier report, then they can be progressed to a lung cancer meeting and meet oncologists and respiratory doctors to have a treatment plan made, hopefully quicker than standard care.
If you've implemented AI to reduce this sort of wider pathway for patients, are you, in your opinion, seeing the impact of AI or how AI is reducing this time?
So yeah, as part of our research study, we are hearing from our respiratory colleagues that patients have been coming through to get their CTs quicker. Key part of our pathway that they're introducing is not only is there an AI first read, but we're also asking radiologists to request the CT scans for these patients rather than the GPs. So we've got sort of a two-pronged attack trying to reduce the pathway duration. And I think that's been working from what I understand with the respiratory colleagues. Obviously waiting for the full results of the study.
Yes, absolutely. So I think this is probably a more important question. How are you seeing patients benefiting from an AI adopted technology pathway as part of lung cancer?
So patients have the ability to get CT scans quicker if they're flagged by the AI correctly. So if the algorithm correctly identifies a cancer or a suspicion of cancer on the chest X-ray, then the radiologist is alerted quickly. And if the radiologist agrees, well, then the patient can come and get a CT scan, ideally within 2 or 3 days of the chest X-ray, which is a significant improvement to what it was beforehand.
Yeah, that's excellent. Because ultimately, I guess when we look at AI, we are looking at patient being the centre of what we do.
Mm-hmm.
So if we are seeing the impact of patients having a reduced time to diagnosis, early diagnosis, then the benefits of AI is a lot more paramount, because patients are what we are there for in sort of healthcare, professionals as professionals. So that's wonderful, and we look forward to seeing some of the results from the Radical study. So as a sort of looking into the future of AI in lung cancer, how do you foresee AI, say 5 years from now?
Yeah, I think it's a really exciting thing to think about. There's quite a lot of studies, and I know qXR are involved in a few of them, that are currently either data collecting or have recently just finished data collection. So it'll be really interesting in 5 years. We'll know what the answer to these studies was. And I think these first wave is going to be really trying to find the optimum use case for this technology. And I think there will be a use case identified for chest X-ray algorithms, whether it's in the use case that we're describing here with triage, or whether there's other use cases such as auto-reporting of normal chest X-rays, remains to be seen. But it will be, I think in 5 years' time we'll know that, so that will be good. So I would foresee that implementation of chest X-ray algorithms being a fairly consistent feature in health. I think the other thing that AI can add to the lung cancer diagnostics is going beyond a chest X-ray, looking at how AI can help us recognize patterns in lung cancer, so deep phenotyping of tumours. So really looking at more advanced imaging such as CT and PET, and marrying that with what we're seeing on the clinical side. So do these patients do well? Do these patients do poorly? And looking at where these patients have come from a genetics, from a pathology side. So really getting that full spectrum of modalities to look at and fully characterize someone's lung cancer. Everyone's really excited about the prospect of AI to assist in picking up these associations and giving us clues, because the real impact of that is if we can know which patients do better, which patients do worse, it will change what treatments we give, and ideally giving people the right treatment. Cancer treatment is fairly challenging, and we want to make sure that if people are going down that route, they're doing it for a good reason, because we have a good reason to believe they've got a benefit. And similarly, the other side is there may be patients who we would typically think wouldn't be good for treatment, but actually we find out from further research that these patients would benefit from treatment. So both sort of getting patients on the right treatment is the key principle. So that's really interesting, exciting. I think we'll be somewhere on that journey in 5 years' time. I don't think we'll have completed that.
Yeah, that's actually a very good insight, and I hope we do get to the point of sort of multi-modality as part of the wider pathway. So yeah, that will be exciting to see in 5 years' time. So finally, just as a sort of departing question, you've been instrumental as part of the Radical study and implementing AI as part of the patient pathway. What advice or any insights would you give to your peers or your colleagues that are thinking about implementing AI in their hospital?
In terms of advice, I would say that this has been a huge learning curve. We haven't done projects like this. AI is a relatively novel technology that hasn't had much of a foothold in medicine up until this point. So there is a degree of working things out as you go along. So a bit of patience there for the clinicians. I think one of our main takeaways is really trying to understand that when you're altering a workflow that consists of a large number of people who are all key stakeholders in what you're doing. So it's essential to bring everybody along on the journey so that people know why we're doing this, how we're doing this, and that everyone feels fully informed and part of that. And also recognizing what that person's resources are in their job. We know that the NHS is stretched. We know that everybody feels that stretch. And so AI has to be something that helps that. It can't be another thing on someone's list. And if during implementation we don't recognize that we're trying to get a bunch of resource-strapped people to do extra resource, we're not going to see the results we want to see.
Yeah, I think that's great advice. And we've seen that in multiple occasions when we implement the AI technology. So thank you for that. And thank you so much for your time today. I appreciate taking time to speak with me. And it's been a pleasure.
Thank you very much. Nice to speak to you.